Hi, this is Emily Fuller, and my part of the presentation is to present an article on ADD or ADHD. So the article I chose about ADHD is titled Adult ADHD, Emotion Dysregulation and Functional Outcomes, Examining the Role of Emotion Regulation Strategies. The article outlines a study that was completed on 159 participants, 59 of which had ADHD and 100 did not have ADHD. The purpose of the study was to determine if emotion dysregulation has anything to do with the correlation between ADHD and certain key domains of functioning and which emotion regulation strategies could relate to this correlation. So in order to determine this, the participants were required to take numerous online self-reports that each measured a different aspect of the purpose of the study. The researchers then analyzed the results and presented their findings. The article explains how emotional dysregulation in ADHD has been previously researched and found, so much so that emotional symptoms were a main criteria for diagnosing ADHD until the DSM-3 was published. Some, but not all, of the emotional symptoms can be explained by ADHD having high comorbidity with other psychiatric disorders. But this study set out to prove that the emotional dysregulation can be related to the functioning in people with ADHD apart from the comorbidity. For the functioning of individuals with ADHD, it looked at depression and anxiety, relationship satisfaction, and other broad functional impairments. The study also wanted to find which emotion regulation strategy, specifically 3 emotional regulation strategies were studied: avoidance, suppression, and reappraisal. So which one of these could link ADHD symptoms to the emotional regulation deficits experienced by those with ADHD, if any could. The researchers predicted that deficits in emotion regulation would mediate the relationship between ADHD and the functional outcomes. The participants took the self-surveys, like I discussed earlier, and the surveys were about rating their ADHD, rating their difficulties in emotion regulation. They had a general emotion regulation questionnaire. They rated their psychological flexibility. They rated their avoidance tendencies, rated impairment in specific daily tasks. They rated their relationship quality and satisfaction. And then they had a screening of their symptoms of depression and anxiety. So they had a lot of surveys and questionnaires to answer for this study. After all of the self-reports were finished, the researchers took the results and outlined their findings. They found from this study that ADHD symptoms were related to deficits in emotional regulation, greater anxiety and depression, lower relationship satisfaction, and greater functional impairment. They also found that the higher the ADHD symptoms that were reported, the greater the use of avoidance, which in turn led to greater deficits in emotion regulation. There were no significant findings regarding the other 2 emotion regulation strategies studied, suppression and reappraisal. They found that almost all of the impairments reported could be at least partially explained by the use of avoidance in the participants. The study explains that these results can really help to determine what type of interventions can be best utilized for those with ADHD. So they explain how cognitive behavioral therapy has been proven to help decrease symptoms in those with ADHD. And with this finding of avoidance being a huge factor in the impairments, the researchers suggest that cognitive behavioral therapy be utilized with decreasing avoidant coping strategies. So helping clients decrease their use of avoidance. And in turn, this might lead to less depression and anxiety and greater relationship satisfaction in those with ADHD. This was one of the first studies to explore the relationship between ADHD and the emotion regulation strategies of avoidance, suppression, and reappraisal. The researchers do note some limitations of the study, such as the results only being measured from self-reports, which could be skewed. They explain the study results. They do not imply causation between the relationships, only correlation. So overall, I found that it was a very interesting study, and the results presented unique findings about adults with ADHD. If you would like to read the study, the article is linked here on this slide. Thank you.